By now, over 125 million Americans are fully vaccinated, but we're not completely out of the woods just yet. So our medical expert, Dr. Payal Kohli, there she is, joins us live. Hey, doctor. So first, we want to ask you about vaccine booster shots. So Dr. Fauci says we'll likely need them in under a year. Can you tell us more about that?
So, Sam, there's really two purposes to a booster shot. The first, of course, is what it sounds like, which is to boost our antibody response if it's starting to wane off. And then the second is to help offer some protection against the variant. So on one hand, you know, being a person who got fully vaccinated in January, I'm interested to know what the science says about how long these antibodies last. We know that they last for at least 6 months, but we don't know what the back end of that is. So I'm really waiting for the science, and I'm glad that they're planning for the booster. But on the other hand, I have a little bit of skepticism because I don't want to make predictions about whether we need booster shots or not. I want to know what the science says, and I know there's, you know, obviously corporate interest in wanting everybody to get a booster shot. So I'm really looking forward to the data that tells us when those antibodies start to go away, and that'll help to guide when we need those booster shots.
Doc, always good to see you and hear you. Do you need to get the same booster shot from your original vaccine, whether it be Johnson & Johnson, whatever it may be?
You know, this is kind of interesting, Jeff. We don't really know the answer, but I think our best bet is probably not. And there's a lot of studies that are actually undergoing right now in the UK that are looking whether mixing and matching actually boosts your antibody response even more. So you essentially get benefits of two different vaccines. For example, a DNA-based vaccine and a messenger RNA vaccine. Could that even be better? So my best guess is no, you're not going to be stuck with whatever you got. Which one did you get?
I got the Pfizer.
The Pfizer.
That's like the best.
Like the Facebook.
The Pfizer.
Twitter. Well, really quick, Dr. Kohli, now we know that some animals are carrying or transmitting the disease, but recently we heard about a newly found coronavirus that might be coming from dogs. So before anyone panics, can you clarify that?
Yeah, so you know, Erica, coronaviruses come from animals. That's been the case for a long time. So I don't want anyone to panic. This was only 8 patients in the hospital in Malaysia who were found to have in their nose a strain of coronavirus that could have originated from dogs. Now, we don't know that that strain made them sick. We also don't know that it's spreading human to human. But this is something that coronavirus in particular does. So it's not something alarming. It's just as this infection continues to spread, we may have to look out for our pets as well.
Wow. Thank you so much, Dr. Kohli, as always.